In our previous video, we have analyzed till question number 40. So this is Uttar Pradesh Veterinary Medical Officer examination question paper, which was held in the year of 2022. So in this video, we will start from question number 41. This says commonest venue of infection is through respiratory, urogenital, alimentary tract, and congenital. So the more appropriate and correct answer for this question is alimentary tract. So alimentary tract is most commonest route through which the infections will occur. Then ovulation in buffalo occurs. In case of ruminants, ovulation occurs after the end of estrus. So before the end of estrus, this is not true. 6 hours after insemination, this is also not even in the mid-estrus. So the most correct answer for this question is 12 to 18 hours after the end of estrus. Now the question 43 says, a bulletin usually contain. So there are 4 things. One is bulletin, then booklet, and then book. Fourth one is pamphlet. So bulletin contain 12 to 20 pages, whereas booklet contain between 20 to 50 number of pages, and in case of book, more than 50 pages are there, and in pamphlet, which contain 2 to 12 number of pages. So these are you must remember with respect to examination. So this question says a bulletin usually contains 4 to 6, 6 to 12, then 12 to 20. The answer for this question is 12 to 20 pages. Then oxytocin is secretion of anterior pituitary, posterior pituitary, intermediate lobe of the pituitary, and none of the above. So oxytocin is actually produced from hypothalamus. Within hypothalamus, there are 2 nuclei are there, and they are supraoptic nuclei and paraventriculus nuclei. So from these 2 nuclei, oxytocin is produced, and that oxytocin is stored in posterior pituitary. So this posterior pituitary will secrete the oxytocin. So the correct answer for this question is posterior pituitary. Along with the oxytocin, posterior pituitary also stores another hormone, and that is vasopressin, which is also called as ADH, antidiuretic hormone. So which retains the water quantity of urine, and also which is also secreted from, or which is also produced from, these 2 supraoptic and paraventriculus nuclei, which are there in hypothalamus. And when it comes to anterior pituitary, this anterior pituitary will secrete FSH, LH, and then growth hormone, and thyroid stimulating hormone. So many other hormones are secreted from anterior pituitary. And then from intermediate lobe of pituitary, there is a very important hormone which is secreted, and that is called as MSH, that is melanocyte stimulating hormone. So this is secreted from intermediate lobe of the pituitary. Therefore, it is called as intermediate, which is called as intermediate. So this hormone will stimulate melanocytes. So those stimulated melanocytes will secrete melanin. So this is about the question number 44. So this melanin helps in pigmentation of the skin layer. And there is another hormone which is usually get confused with this melanin, that is melatonin. So that hormone has a role in circadian rhythm of the body. So that is melatonin, which is secreted by pineal gland. Now question number 45. Which method of selection is adopted widely by livestock breeders? Tandem method, independent culling method, selection index method, and none of the above. So this tandem method involves selection based on only one trait. So it has its own demerits because other traits are missed out. And in case of independent culling method, so it involves if the animal will be disqualified if it fails to satisfy even in one of the several traits. So such type of selection method is called as independent culling method. And in selection index method, it usually involves overall genetic merit. So overall genetic merit of the animal is calculated based on multiple traits. So these multiple traits have been giving a composite score or index. So based on the how much the index or the composite score is there, so based on that the selection will be done. So selection based on index method is the most widely adopted selection method for the livestock breeders. So therefore the question number 45, the answer for this question is C, that is selection index method. And then this fleek index is commonly used method for the evaluation of haylage, silage, wastelage, and down hair. So the answer for this question is silage. So here in this fleek index, actually it is based on a score that is called as fleek score. So this fleek score is dependent on 2 parameters, and those were dry matter of the silage and then the pH of the silage. So based on these 2 parameters, a particular score is generated. So based on this score, the silage has been classified as 5 categories, and those are as very good category, good, and moderate, then low, and very low. If in case of very good category of silage, the fleek index or fleek score ranges between 80 to 100, and in case of very low category of silage, the Fleeg score is less than 20. So these things are very important, and they have been asked several times in previous examinations. So you must have to know and understand these things with respect to Fleeg index. And then question 47 says, due to homogenization, area of milk fat increases how many times? So this question says, through the homogenization, the area of the milk fat will increases by 5 times. So the correct answer for this question is 5 times. So one should not get confused. This homogenization will of course increase the area of milk fat. That is, surface area of the milk fat is increased, but the size of fat globules will be reduced. So it should be no. The surface area of the milk fat will increase, but the size of the fat globules will reduce. Then one of the following is clinically used as an anticoccidial agent. This selinomycin has also property of anticoccidial agent. Then question 49 says, with reference to postmortem examination of chronic disease, which is also called as Newcastle disease, so which of the following statement is correct? Statement 1 says, carcasses with systemic involvement are unfit for food. So this is correct. If lesions are realized, only affected parts are condemned, and then rest of the parts are passed for the food consumption. So both the statements are true. In question number 50, which technique is employed in computer analysis to calculate least cost ration? So the answer for this question is linear programming is employed to calculate the least cost ration through the computer analysis. Buffalo is monoestrus, polyestrus, diestrus, none of the above. So usually buffalo is polyestrus. Buffalo and cattle are polyestrus, whereas bitch dog is monoestrus. And poultry disease, infectious coryza is caused by. So this is a repeated question. So in our previous part also this question has been asked. Option A, Haemophilus gallinarum, then Aspergillus flavus, Mycoplasma gallisepticum. So answer for this question is infectious coryza is caused by Haemophilus gallinarum, and this Aspergillus flavus will cause aspergillosis, and this Mycoplasma gallisepticum will cause chronic respiratory disease in birds. A suitable vaccine for FMD, that is BCG vaccine, spore vaccine, polyvalent tissue culture vaccine. So this is the correct answer for this question. This 54 says artificial insemination of cattle in India was first time attempted at and in the year. So actually in Karnataka only this has been attempted. That is AI for the first time in cattle has been attempted in dairy farm Mysore in the year of 1939 by Sampath Kumaran. So this is very important name, you have to remember. Sampath Kumaran has attempted the first artificial insemination of cattle in India in dairy farm Mysore in the year of 1939. Then which of the following is not correctly matched? Elephant foot camel, laminitis liverfoot, crocus screw claw inherited defect, beak claw curable. So this is a very tricky question. Elephant foot is a disease which caused in elephant, which caused in a camel. So which is due to the agent called as Dipetalonema evansi. So this is responsible for the filariasis, that is camel filariasis, which is also called as elephant foot disease. Now laminitis is also called as liverfoot. This corpus screw claw is an inherited defect. This is correct. So here if you observe, beak claw is, they mention it as curable. It is actually a permanent and incurable. So this beak claw and this corpus screw claw occurs due to a genetic change or genetic mutation in the parents. Then question 56 says, match the following. Here the species are given along with their larval stages are there. We have to match them. Tinea hydatigena, that is Cysticircus tuniculis, and then Tinea multiceps has a larval stage that is called as Cinerus cerebralis, which cause GID. And then Tinea ovis, Cysticircus ovis, and the last one is Tinea teniformis, that is Cysticircus faciolaris. Now we'll look at question number 57. This says, first embryo transfer technology project in the country was initiated by NDRI, ICAR, National Bureau of Animal Genetic Resource, and National Dairy Development Board. So the correct answer for this question is National Dairy Development Board, which is located at Gujarat. So this NDDB has been established by Varghese Kuren. So that is Dr. Varghese Kuren in the year of 1965. So the objective of establishment of this board is to replicate the achievement which is done through the Kerala Cooperative Milk Producer Union. So that is also called as AMUL. So that is Anand Milk Union Limited. So to replicate the achievement of this cooperative throughout the India, Dr. Varghese Kuren in the year of 1965 established this National Dairy Development Board. So this board has only initiated the first embryo transfer technology project in our country. Now this National Dairy Research Institute is located at Karnal, that is in Haryana, and then IVRI, which is located at Barel Ki Barfi in UP. And then this National Bureau of Animal Genetic Research is also located at Karnal, Haryana. So next, the question number 58 says, extension teaching method, debate is. So debate is individual, no, it is not a mass, so it is group contact method. Which of the following is eliminated, that is 80% by biliary secretion? Through the biliary secretion, cephalosporin is excreted. The cephalosporin is class of third generation cephalosporin, whereas this cephalosporin is first generation, and then cephaloxime is second generation, and the cephaloxytin is also second generation. These cephalosporins are belongs to the class of beta-lactam antibiotics, along with penicillins and monobactam, carbapenems. So these are also beta-lactam antibiotics. Their mechanism of action involves they inhibit the formation of cell wall by binding to a protein called as penicillin binding protein, so which is also act as an engine, so which helps in the formation of peptidoglycan in the cell wall of the bacteria. So thereby these cephalosporins and beta-lactam antibiotics inhibit the formation of peptidoglycan, and through binding the penicillin binding protein, thereby in the end which inhibit the formation of cell wall and leads to the death of the bacteria. Then question 60 says, match list 1 with list 2, that is the match the following. Here they are given the zoonotic diseases, the type and the disease. Amphigynosis is salmonellosis. So amphigynosis, which means the disease which transmitted between the both from the human to animal and also from animal to human. Then zooanthroponosis. So this zooanthroponosis is tuberculosis. So here in zooanthroponosis, a disease is transmitted through human being to animal. So this is also called as reverse zoonosis. So the example for zooanthroponosis is tuberculosis. And then saproanthropogenosis. So in this type of zoonosis, here there is the involvement of non-animate substance such as soil for the transmission of the disease agent and the disease itself. So such type of diseases are called as saproanthropogenosis. So then the example for such type of disease, such type of zoonosis is ankylostomosis. And at last, that is non-obligatory cyclogenosis. This non-obligatory means it does not require any human host. And this cyclogenosis means the disease must and should require 2 vertebrate hosts in their life cycle. So the example for non-obligatory cyclogenosis is hydatidosis. So hope the things are clear. Now let us look at question number 61. In dairy cattle, the time taken for complete uterine involution, 4 to 10 days, 10 to 20 days. This is too early. And this is the left one, that is 26 to 50 days postpartum. So actually in cattle, there is a dairy cattle and then beef cattle. For dairy cattle, it takes around 26 to 52 days postpartum for the complete uterine involution. And in case of beef cattle, it takes 37 to 56 days for complete uterine involution. And when it comes to buffalo usually takes a longer time for their involution, and it is around 60 days postpartum. Now question 62 says, so consider the intramuscular fat percentage, arrange the following in ascending order. So there is some confusion with respect to the intramuscular fat because different literature mentions different percentage. So in general, Q1, which has less as compared to other meat in intramuscular fat, and then Q1, then pork, after pork, mutton, that is the meat of sheep, and then beef. So beef has higher intramuscular fat percent when compared to other, and this Q1 has very less intramuscular fat percentage. This is in general, but these data are varies from literature to literature. So we skip this question. Now question number 63 says, what should be the number of motile sperm per straw in cryopreservation? So the general range is 10 to 30 millions sperms. So 5 to 10. This is 10 to 15 also not correct, and 20 to 25. And here this is 25 to 30 million. So broader range we have to this. This is the correct answer for this question. Medusa head colony is characteristics of Pasteurella multisoda, Bacillus anthracis, then Haemophilus suis, and Clostridium tetani. So the answer for this question is actually this is Bacillus anthracis. So this is a gram-positive bacteria which cause anthrax. It is very deadly disease. And then when it comes to Pasteurella multisoda, which cause hemorrhagic septicemia, specifically serotype B2. So serotype B2 of Pasteurella multisoda will cause HS, hemorrhagic septicemia. So this Pasteurella is a gram-negative bacteria. This Bacillus anthracis is gram-positive, and then Haemophilus suis, so which cause a disease called as Glasser disease, And there is a factor which is responsible for this disease or pathogenesis is V factor. So several times this question has been asked in the examinations. So you have to remember this. V factor is the responsible for the disease, glass rust disease, which is caused by the organism that is Haemophilus suis. So which is also gram-negative bacteria. And then Clostridium tetani, which is a gram-positive bacteria which cause tetanus, and it also produces two types of toxins as hemolysin and titanospasmin and titanolysin. Titanospasmin is the toxin which is responsible for the disease of tetanus. Then question 65 says as the following. Here some of the drugs are given and they are effective in which agent. So the first anti-emetic drug is disystole. So actually disystole contains dichlorophene. So this dichlorophene are effective against tapeworms. And then carbon tetrachloride, which is used to treat liver fluke, but nowadays these are outdated. They are not using these things. Liver fluke for carbon tetrachloride, and then thiabendazole used to treat strongyles, and then piperazine salt for the ascarid worms, that is roundworms. And question 66 says the quarantine period for most of the animal disease is 8, 15, 20, 30. The answer is 30. And this 67 says frontline demonstration is a concept of field demonstration. So this is a concept of field demonstration, which means to say that any production and a production technology is directly demonstrated in the farmer's field itself. So such type of techniques are called as frontline demonstration. So which is evolved by ICAR. So the headquarters of this is in New Delhi, and this is discussed in DDB in Anand, Gujarat, and this is IARI, Indian Agriculture Research Institute, which is located at Pusa Institute, that is also in New Delhi, and then IVRI in Bareilly, UP. So here also the vaccines are given against the disease. Murex disease. The vaccine used is HVT, that is herpes virus of turkey vaccine. So actually this herpes virus of turkey is antigenically has a similarity with respect to Murex disease virus. So therefore this vaccine is used to treat or to vaccinate this birds for against the Murex disease. And then avian spirochetosis is caused by Borrelia and serina. So this is the agent which causes spirochetosis, and the vaccine used is a formalized type of vaccine. And then for fowl-pox, live attenuated virus vaccine is used. And in case of Newcastle disease, there is different strains are there, such as velogenic, mesogenic, and then lentogenic. So these strains are used for the production of vaccine. So this Mutkaeswar strain is a type of mesogenic strain. So by using this Mutkaeswar strain, the vaccine is produced against the disease, that is Newcastle disease. And there are different strains of the Newcastle disease are there. One should have to remember these strains with respect to exams. So as we just now discussed, this Mutkaeswar strain is mesogenic. In case of lentogenic, the strains such as B1 and Lasota. So these are also used to produce vaccine. Now question 69 says in birds, egg yolk is formed in. So in which portion or which organ this egg yolk is formed? Uterus, ovary, isthmus, magnum. So the correct answer for this question is ovary. So inside the ovary, yolk will be produced. So within this yolk, there is a genetic material for the female is there. So inside this yolk is found in the ovary. So this ovulate as a yolk which contain a female genetic material. So from then the next part of the tube is infundibulum. So which collect the yolk. So infundibulum function is to collect the yolk. So if there is mating, then the fertilization occurs in infundibulum. So the thing is that is in infundibulum there is fertilization will occur if the mating occurs. Then from infundibulum the next part is magnum. So inside the magnum the albumin is secreted. That is albumin. Albumin is also called as egg white. And then the next part is isthmus. So in the isthmus there is the formation of cell membranes are take place, and from then it will migrate to uterus, and in the uterus where there is the formation of cell and cell figments are noticed. So therefore uterus is also called as cell gland. And after uterus the egg structure will enter the vagina. So this vagina will act as a holding which hold the egg, and then from cloaca and vagina these two organs take part in the oviposition, that is laying of the egg. So this is a route through which egg is formed in the bird. Now, in which animal a JAD test, that is Asian Jadak test, is used for the diagnosis of pregnancy? So the answer for this question is mare. In case of horse, this technique is used. So in this technique, a serum of pregnant mare is collected. Serum of pregnant mare is collected, and that serum is injected into immature. So this is very important. This question has been asked. Immature female mice. So once this serum of the pregnant mare is injected into the immature female mice, so that will lead to the changes in the ovary of the mice. So this ovary will become hemorrhagic. So these are called as hemorrhagic corpora, and also the uterus will swell. So these changes is because of the serum of the pregnant mare contain a hormone called as ECG, that is equine chorionic gonadotropin, so which is secreted by endometrial cups. So because it is secreted from the endometrial cups, before 40 and after 150 days, this result is not accurately predicted. That means to say that there is a high probability of negative result of this AJ test will be given if we conduct this test before 40 days of the pregnancy and after 150 days of the pregnancy. Because before 40 days, there is very less amount of ECG will be there, and even after 150 days also the amount of ECG will start decreasing. So therefore the best days for the conducting of this test is between the 40 to 80 or even 90 days. So between these days the test will give its best result. So this is about the AJ test. And then question 71 says, drug used in treatment of schistosomiasis in animal cells: triclopentazole, ivermectin, niclosamide, frazoquintal. So the correct answer for this question is frazoquintal. This schistosomiasis is a trematode. Even though it is a trematode, the drug used is frazoquintal. And the dose rate varies from species to species. In case of cat and dog, the dose rate is 5 mg per kg body weight per oral is given. And this triclopentazole is used to treat fasciola species, and the dose rate is 10 to 12 mg per kg body weight. And ivermectin is the endectoparasiticide. So this is about question number 71. Now look at question number 72. As per the guidelines of the Department of Animal Husbandry and Dairying, the sperm concentration in stored straw or post-thaw progressive mobile sperm in sex sorted semen shall not be less than, that is 2.1 million for 1.3 per straw. So this is the answer you have to remember. There is nothing much you can do for such questions. And question 73 says, which of the following is not correctly matched? Here they are given poisons and their antidote: arsenic, white of egg; HCN, inhalation of amyl nitrate; and then organophosphate, atropine sulfate. This is true. And urea, 10% acetic acid is also correct. So then we left with the HCN, that is for cyanide. Inhalation of amyl nitrite is used. Along with this, there is some other two agents are there, and that is sodium nitrite and sodium thiosulfate. Along with this amyl nitrate is also used as an antidote for cyanide poisoning. And then in case of arsenic poisoning, the antidote used is BAL, so which is well known as dimercaprol. This BAL stands for British Anti-Levisite. So this is about question number 73. Now let us look at question 74. Match the list 1 with the list 2. That is the following. Here they have given breeds and this home tract of the breed: Muzaffarnagari. So this breed is noticed in UP and Uttarakhand. And this Garol breed is of West Bengal, mainly which is noticed in Sundarban Delta. And even in Bangladesh also this breed is very famous. So this is mutton sheep breed, which is used for mutton, which is a sheep breed. And then this Jaloni is also meat breed, and which is seen in UP and MP, Uttar Pradesh and Madhya Pradesh. And then this Chota Nagpuri, as the name itself indicates, Chota Nagpur Plateau, which is there in Jharkhand. Now question 75 says, how many times vitamin A is found in colostrum in comparison to the milk? The actual it is not as 9, 10, 11, 12, but the range is there. The range says 5 to 15. So I don't know how to answer this question. So you at least to remember this range: 5 to 15 times there is higher amount of vitamin A is there in colostrum as compared to milk. Then this question 76 says, there are two statements: assertion and reason. Assertion says the infant cows require a high percentage of protein in the ration. This is true. because microbial protein synthesis is very low in infant calves. So this is the correct reason for this assertion, therefore the option A is correct. And question number 80 says, as per the ICAR, National Bureau of Animal Genetic Research, which is located at Karnal, Haryana, at present, total number of registered breeds in buffalo in country. So this video has been recorded in the month of October in the year 2025. So I just now checked through the Google. By this time, I mean to say by current time, there are total 21 registered indigenous buffalo breeds are there. So the number of the breeds is, for buffalo breeds is 21 indigenous. And the question 79 says, from which day of the age hay can be given to newborn calf? 10th day, 15th, 20th, or 1 month. So actually it is from 1 week to second week. From the onset of second week, we can start feeding the hay. So the most appropriate answer is 15th day. So from 15th day onwards, we can feed hay for the calves. And the question 78 says, most hygienic and efficient method of milking in buffalo is stripping, dry full hand, wet full hand, nothing. If there is only full hand is given, then we have to go with the full hand. They have segregated it as a dry full hand and wet full hand. So this wet full hand has a demerit as it may cause contamination of the milk. So the dry full hand milking is the most efficient and preferred method of milking in buffalo. So this stripping is employed at last of the milking. So this stripping will result in the increased fat in the milk. So knuckling is not at all suggested, and it is the bad milking method. Now let us look at the last question of this paper. Which species is the most efficient amplifier host of Japanese encephalitis? Monkey, cattle, pig, sheep. So the answer for this question is pig. So the pig acts as the amplifier host for Japanese encephalitis. So we have completed this whole question paper of veterinary medical officer, which was conducted in 2022. There were totally 80 questions. And the paper was medium range, not even that much very hard, and also not easy, as many questions were more factual. There is very less analytical thinking is required for this question paper. So it tests aspirant's memory much than his understanding. So in my opinion, this is not a good standard paper to assess for someone who is aspiring for a veterinary medical officer. So this is about it, and in next video we'll come up with some other state question papers. Thank you.